What can healthcare learn from maybe education or some of these other market segments that you work in?
From an education standpoint, I think the biggest thing is how, we're starting to look at artificial intelligence and how it manages the networks and
Mm,
helps with what we call assurance, which is basically making sure the network stays stable and reliable. From a retail standpoint, I think healthcare can learn a lot from the customer engagement model done by most large retailers who they have to do really good customer engagement today to survive. COVID taught them that, right? People weren't actually going into stores, they were
mm.
ordering online. Everything kind of became virtual. So now when folks walk back in the stores, you got apps that pop up and tell you you've got a coupon or whatever. From the healthcare standpoint, we could leverage that for things like automated appointment setting, managing operating room suites more efficiently. Uh,
So why
you know,
haven't we done that? The technology's been available. You and I have talked about it. We've probably each done deployments in this area. Why hasn't it taken off in healthcare where it has in retail?
well, think ultimately what happened with healthcare has always been constantly driven around patient care, right? And patient care is more of a process within each healthcare organization. They have their processes and their workflows. What you look at in the retail is it's more not about patient care, but patient happiness and satisfaction. And that's the difference. In simplification, making it easy for people to know when to come to the hospital because they've got a same day procedure that's going to be in the same day surgical suite. So knowing when to leave the house, how long it's going to take them to get there,
Hmm.
pulling all these different things together, ultimately improve the bottom line for the healthcare organization, but also improve the satisfaction for the patient because the patient's going to know what they need to do to get there.